Thanks for staying. Let's start with our very first story. And Ghana's COVID-19 case count is ticking up again. The Ghana Medical Association is concerned and is thus urging all to ensure strict adherence to all safety protocols. We'll come to their concerns shortly, but what exactly does our case count look like as of today? Let me take you to the Ghana Health Service website and share details with you from there. And as you can see, the new case count stands at 321. And with the active cases, we've seen an uptick with 3,165 cases now. In terms of the overall confirmed case count, it stands at 134,555. And out of these, 1,269 have lost their lives, and we have recoveries or those discharged summing up to 129,921. As you can see in the bottom left corner as well, at least what is visible, you would see that the Greater Accra region is in quite a lead there with over 72,000 cases, and that indeed is a cause for worry. So those are some of the details we can share with you as of now when it comes to the COVID-19 case count, numbers rising. Now, the Greater Accra and Greater Kumasi regions are the areas with the most alarming figures so far. And this, the Ghana Medical Association attributes to the new Omicron variant. It is thus urging all to report to health facilities for proper diagnosis and treatment while adhering to all preventive protocols. Let's get details of that statement from the Ghana Medical Association issued last night on the back of these developments. And that's the statement right there in your shot. And it reads, press statement, COVID-19 and Christmas or New Year festivities. It says, in the last couple of weeks, our COVID-19 testing sites and health facilities have witnessed a sharp increase in the number of positive cases over the last 1 week, especially in the Greater Accra and Ashanti regions, with alarming daily positivity rates ranging between 40 and 50%. This escalation in cases is likely driven by the Omicron variant of the SARS-CoV-2 virus, which is highly proving to be more transmissible than the hitherto dreaded Delta variant, which dominated our third wave of COVID-19. This is a very worrying development which calls for concern by all well-meaning Ghanaians, especially as we enter the Christmas and New Year festivities, with their characteristic mass events and celebrations that tend to bring huge numbers of people together. Ghanaians are therefore entreated to visit health facilities to get tested if they have any headaches, extreme fatigue, fever, and other flu-like symptoms, and as much as possible, desist from self-medication, especially for unproven malaria. It ends, it is of utmost importance that as we enter the Christmas or New Year period, we take these facts into consideration to avert a fourth wave. One, the COVID-19 pandemic still poses an existential challenge to the health of all persons living in the country. And two, the escalating cases or escalation of cases of the disease, if not checked, has the potential of further weakening our already fragile health system. There are a number of points. So the third one, the non-adherence to the preventive measures, especially during this festive season, has the potential to further escalate the spread of the disease and its attendant consequences for individuals, families, and the country as a whole. Here's more. All Ghanaians should take advantage of the Ghana Health Service and, for that matter, government's drive to vaccinate all Ghanaians of age 15 years and above. The GMA also calls on central government, the Ghana Police Service, all metropolitan, municipal and district assemblies, as well as the Ghana Tourism Authority to strictly enforce all COVID-19 protocols at all events. It goes on. But the sixth point, government should also ensure prompt, continuous and adequate supply and distribution of PPEs. Then the GMA is calling for an urgent scale-up of COVID-19 testing and contact tracing for all positive cases, as well as strict isolation and management of all infected persons to help break the chain of transmission. The last 2 points there, the Ministry of Health or Ghana Health Service and the National Commission for Civic Education should relaunch and intensify COVID-19 education. The GMA also urges all media houses to continue their good work on COVID-19 public education till the virus is defeated. The very final point now, The GMA entreats all Ghanaians to take their personal safety into their hands by adhering strictly to all the COVID-19 safety protocols. We celebrate the birth of Christ and the new year. And it's signed by Dr. Frank Serebour, President, and Dr. Titus Bayou, who is General Secretary. So that is the statement there, and the catchphrase is that all of us should basically try to get vaccinated and stay cautious during the season. Let's now bring you excerpts from PM Express, where a number of the guests have been giving us more on that situation. We start off with Dr. Frank Serebour, who says even doctors are getting infected with the new variant. The reason, you cannot let your guard down.
We are having a lot of cases in the hospitals at the moment. We have some of our doctors who are testing positive. A lot of the nurses are testing positive. Indeed, there are some wards in some hospitals that are basically now being run by other people from other wards, meaning that all the people in those wards have tested positive and they are supposed to go home. As I speak to you, I am in a very small facility, but I can tell you that 3 of my doctors, we are only 7 doctors, 3 of us have already tested positive. And it's not like they are just asymptomatic, they are symptomatic, and so I have to let them go home.
Are you yourself, does it include you?
Unfortunately, I have not tested because I have not had any symptoms, but they have symptoms as of yesterday.
Okay.
And so we did a test, and as of now, 3 of them are supposed to go home, and they are home, meaning that out of the 7, we have only 4 doctors available to do the work of the 7 people for probably the next 1 week or 2 weeks. And until recently, even our COVID center had been was virtually empty. We are beginning to see cases. So the situation in the hospital is not that good. Our colleagues in the testing sites are reporting that now when samples come in, you can predict that about 60 to 80% of the samples will test positive. And so clearly, the situation is not.
Well, he has also been calling for the arrest and prosecution of persons who flout the protocols.
I'm happy that Ghana Health Service has gotten involved to ensure that at least they are meeting event organizers and they are able to be part of their programs and make sure that they're able to regulate and restrict. But just like Kwame said, we can add another layer to it, and that is to do with the antigen testing and, of course, be able to let people prove that indeed they have had their vaccines. After all, that is what Ghana Health Service is advocating for, that for events of such nature, before you go in, you should prove that you are vaccinated. And indeed, with an ID card, not just the vaccination card, because vaccination cards alone does not mean that there is the same person you are looking at. So we need to make sure that those individuals come with national identification cards, and we are able to match the vaccination cards with their ID cards. And beyond that, at least do the antigen test. And after all, when you are coming into the country and you get to the airport, regardless of the number of people who are masked up at the airport, you still have to have an antigen test done, and then your results are declared before you are allowed to enter into the country. And so here, if you choose to go for any program, then you should be ready that when you are going, definitely all the protocols would apply. You have an antigen test done, and you have to prove that you are vaccinated. And once we are able to do that, I believe that it will be more of a double protection for all of us. And I am happy, very happy that Ghana Health Service is getting involved in the events, because if you don't get involved, what you have to do is that then you have to go the brutal way, engaging the security agencies to go and enforce that people are following the right rules and regulations. That is very difficult.
Yeah.
But once you engage them and you are able to regulate it, you are part of the system, and then all of us are advocating at least some level of protection that we can put in place, and add to that the antigen test and, of course, the vaccination. I believe that will be very great and will be very helpful.
Well, staying on that beat, Dr. Abuaje da Costa has been telling us about the outcome of an engagement with event planners for the festive season on the adherence to protocols.
It came up at the meeting, but these are things that we've been doing. For example, if you look at the Youth Connect, we deployed the Greater Accra Regional Team, and they did the antigen test. So, and we told the event organizers that the conversations will continue, is ongoing. So any suggestions that we believe that it will avert any possible surge or any increase in cases, we will let them know. It's a good idea, and we will take it on board to engage further. I mean, I'll be speaking to my Director General and the whole team to see how best we can assist them with the antigen test. But we've done it in the past, and I don't think there is any problem for us to